Are you currently looking for a home care provider but you don't know where to start? Your loved one is coming from a care home, or maybe you don't have any experience within the care industry. This video is for you. Hi, my name is Portia and I am the director of Aria Care. I'm a registered nurse and a midwife by background. My background stems from complex care management and continuing healthcare. So glad that you clicked on this video because there's so many mistakes that families make in regards to picking home care providers, and I ensure you that when you finish the end of this video, you will at least have one good thing that you can use to find your next home care provider. So throughout this presentation, what we will actually look at is just discussing what a home care provider is in the UK, what services they offer, how are they regulated. Then we'll look a bit more about the regulated service called the CQC, the Quality Care Commission, and with that we'll see how, when they go for inspection, what are the things they look for to ensure that the service is running well. We'll go into more about other ways you can find home care services, as well as certain questions you should be asking to ensure that the home care service that you've chosen is the right one for you. So before we actually delve into how to find a good home care provider, let's just discuss what a home care provider is. So a home care provider deliver a variety of different services, which can include personal care, nursing care, and companionship. And the aim is to help improve the person living at home, their quality of life. It can include medication support, it can include continence support, it can include just encouragement, companionship, speaking, talking therapy, it could include shopping. It just depends on what type of services that you are looking for. So you're thinking, okay, these are home care providers. I know what it is now, but do I need one? Who benefits from it? The people that benefit from it, I would say, is individuals, children, adults, older adults who may have a chronic condition, disability, or just recovering after a hospital stay, and they need that sort of independence to support them to have that good quality of life. I thought with here, some home care providers essentially get it wrong. They try to medicalize the environment too much. There's been instances where I've had clients or service users come to me and say, sometimes these providers, they treat my home like a hospital. But sometimes providers come in, they put all these tasks, they put all these documents and say, we have to do this, we have to do this, we have to do that. So you have to realize these providers have to put a personalized approach to care. You're coming into our home. How can you ensure my safety and still preserve my dignity, still preserve my personality, still preserve my culture, my beliefs? How can we entail those together to ensure that the care that's been given to me, I love it. Nobody wants to stay in hospital for a very long time, but nobody wants to go home and feel like they're still in hospital. It's so essential that these providers know exactly your background, know exactly what your home environment is, know exactly what you want in their care. So now you've taken the first step. You've decided, yep, I need a home care provider because I need maybe support with my medications. I need support with continence care in the morning, someone helping me to get up, have a shower, helping me brush my teeth, maybe helping me making my meals, making sure I eat, or it could be complex, like I need someone to administer my IV medications for me, administer my PEG medication for me, ensure my tracheostomy site is clean, suction. So you need to find out what type of needs that you have that you want the care provider to meet. A good way to do is to use home care listing platforms that show all the care providers. This could be through Lottie, this could be through Home Care, Care Choices. And these providers, they're very, very good at showing the care providers in your areas, showing the reviews, showing what CQC said about them. Some, I know Lottie does, will say the care provider hasn't been inspected yet. So with that, it will have the website of the care provider. So it'll be a good thing to click on the website, go through their services, what they provide, what is their mission, does it align with yourself, does their values align with what you're looking for, before you say, okay, I'm interested in this service. So you've done all this research. So by the time you pick up the phone and you speak to them, you already know who they are, you already know what service they provide, you already know their reviews. So when you have that conversation, you're very confident in asking questions and you're just testing to see what is seen on the website, what is seen on the CQC reflects how they conversate with you. And don't be shy, because once you lock into that contract for however long, you want to make sure that you make that right decision. The worst case is to feel like a care provider just cares about the money and doesn't care about you. Maybe they started providing personal PPE such as gloves, aprons, tissue towels, and then all of a sudden they're saying that they don't provide that anymore. or they're saying that they don't want to provide the good quality ones they were providing before, but they want to provide a cheaper alternative. And that's something they don't put in their contract that they're going to do later on. So have that discussion and be very, very open and honest to say, this is what I want for my loved one. This is what I want for myself. Are you able to provide me that? And will the quality of care that you provide at the beginning, would that change as the years go on or as the month goes on? Another way that you can typically find where good home care services is through your GP, or if you're at a hospital, the discharge service team. They might have a home care provider they are familiar with, that they work with, that they know, that they referred many clients to, that have had, good positive outcomes. Just have a conversation with the discharge team, have a conversation with your GP and see what they can refer you. Maybe they're people local to your area. They might give you a list of home care providers that are good, and then you do your own research. So now you're on the phone to them. You might have the registered manager on the phone, you might have a nurse on the phone, you might have a care coordinator on the phone. This is a good time to sit down with your loved one or yourself to see what are we struggling with and what do we want a care provider to give to us. Don't go in not knowing what you want. You have to be detailed. So later on, when they're personalizing your care plan, you guys are on the same page and you ensure that whoever reads that care plan, whoever comes into your home, whether it is a staff member, whether it's yourself, a loved one, when they read that care plan, it's like a story. You know exactly from breathing to continence, to socialization, to communication. Another good one to ask is staffing. When the staff come in, do we get to see them? Is there a meet and greet? Do we get to discuss and see who they are? Do we get to choose the type of carers that we want? Are they trained? What type of training do they do? Is it the training that they do related to what care that we need? So these are all the type of conversations you need to have. And even with staffing, how soon can they come in? And when they start, do they have shadowing shifts? How do we ensure that the care staff you're providing for us, they know what they're doing? And who checks they know what they're doing? Is there spot checks? How often are the spot checks done to see that they're doing their care well? Are there supervisions, clinical supervisions to check that they're competent with their skills? Another good thing to discuss is what systems are in place to keep you safe. What risk assessments do they do? Do they do a infection control risk assessment? Do they do an activity risk assessment? What are the systems, the tools they use to ensure that the care that they're providing or the surrounding areas that they're caring in are low risk? Another important step, care plans. How do they formulate their care plans? Do they just take your medical history and just shove it in there? They don't personalize it. They don't consider you in that conversation. They don't consider your family in that conversation and says, yep, we made a care plan. We're the professionals, deal with it. No. Is there a meeting to discuss your care plan? Do you get to say what you want to be in the care plan? What is that balance? You want to co-produce the care plan with them and not them do it all by themselves. Another thing that you need to consider is if anything was to go wrong, who looks into it? How quickly do they look into it? What is their process for it? And if it's the case where, let's say the care provider is in the wrong, are they able to hold themselves accountable? Do they lie? Do they sneak it underneath the rug? Do they say, oh, just forget about it, And it's a shame because I know so many families, so many clients that I've worked with where they feel like the service providers have done them wrong and they haven't been accountable. They haven't owned up to it and said, we're very sorry. We know we've done this, but we're trying to improve. They just sweep it underneath the rug. And it's very sad because the energy that they get at the beginning when they sign that contract is so positive. And as the years go down the line, the effort, the compassion, the care that they had at the beginning, it dwindles. And I understand that some families, they're so shocked. They just think, why? Like, I've been with them for such a long time, they're getting funding from the government. Why are they treating my loved one like this? And for me, that really pulls string in my heart because I never want anybody to be in a situation where they feel like they've been lied to. They feel like they can't tell anyone about the problems. They think that if they do report the care providers, the quality of the care will be less. And I assure you, if anything is happening to your loved one, if anything is happening to yourself and you don't feel safe, let somebody know. It could be a family member, it could be the GP services, it could even be the Quality Care Commission, the CQC. If you go on the website, there is a line that you can call that you can explain what you're feeling. You can explain that the care that you're being given is not adequate. And the great thing about this is You don't have to reveal who you are. If you are funded by the local authorities, go back to that local authority and explain your concern, because then they can help you look for other potential care providers who can give you better quality of services. The worst thing to happen is to be miserable in your own home. If a provider is good, they'll have good leadership, they'll be understanding of your concerns, they will sit with you, they will take time with you to see how can we support you. Good communication, good leadership, good governance is all key characteristic. Call and they say call back later, which I understand sometimes things do happen, but if you keep calling every day to raise concern and they say call back later, or this person will call you, or this person will call you, oh no, this person will call you, and they hang up and they don't call you, not good communication. If you haven't found a provider yet, these are the questions you need to ask instead of rushing into a care provider, being locked into a contract that you can't come out. And that comes to the end of this video. If you enjoyed this presentation, please comment down below. If you have any questions that you want answered, please also comment down below. If you're at home and you don't have funding support from the government, you can't afford home care at the moment, please continue learning with us down below, where we provide digital products to help you care for your loved one or yourself at home. We also have a school community that you can continue learning with us, and have an area, a community of people that you can discuss things with, ask questions, ask me questions. There's webinars, there's additional teaching, and live courses that you can do to help you feel confident with caring either for yourself or your loved one at home. Thank you so much for tuning in. Thank you. Bye.